maybe if we could switch gears now, obviously, as I alluded to at the start of this, we had a pretty successful and fun webinar last week pertaining to dermatology and how it's been affected by COVID-19, and just the sheer input we've received from the audience members in terms of submitted questions for you and our team of panel experts that night was almost overwhelming. It well exceeded the 20-minute Q&A slot that we had planned out, so we thought it'd be good right now to actually run through some of those questions that we had left over and kick it back over to the expert to give us your thoughts and perspective on them. And again, this is completely COVID hook, so if you don't mind, let's just run through a handful of leftover questions.
Sure.
All right, great. So first and foremost, we received this one. Can you see persistent generalized urticaria without any other symptoms in COVID-19?
I've seen some of this so far, actually. In fact, I shared with you a couple minutes ago, we were talking about something unrelated, but that I mentioned that I actually had a case yesterday of a young man who presented with some hives, some urticaria, and he appeared to have some other skin lesions that were of different morphology, and he looked like he might have had the so-called COVID toes. With this primarily generalized hives, despite that skin presentation, he really had no other systemic symptoms. And so this is possible. We have been seeing some rashes. I had another case with one of the colleagues in my group just about 3 weeks ago of a young man who presented with a morbilliform rash, which is a very viral-like looking eruption, no sore throat, no other symptoms of COVID, but he had been exposed to someone, his family, that had COVID and had not yet been tested. So I think that answers the question well, that first and foremost, there's a lot of uncharted territory here. And so I think that anything is possible. But to the excellent question, we are seeing some patients, and they've mostly been young patients, coming in with some cutaneous eruptions and sometimes no other symptoms of COVID-19, such as the cough or sore throat, fever, loss of smell, loss of taste, and the like. Good question.
And that's pretty consistent with what we've seen, generally speaking, with younger patients being more likely to be fewer symptoms or even asymptomatic to it. So that's pretty interesting to see.
Yeah, I don't know that we want to oversell that. There's certainly been young patients that have been significantly affected by this, where we're hearing more and more reports as time goes on. But I think that has been the general consensus, that the younger patients do well. They've had fewer symptoms. And once again, to the question, we have seen some patients presenting with what we're learning more are these COVID rashes. And yet the symptom complex isn't necessarily inclusive of all those common physical features, respiratory symptoms that we're seeing in some patients. Great question.
Sure, yeah. And the next one that we had from an audience member, they had reported that they had seen pictures of COVID-19 patients showing what appears to be thromboembolic cutaneous changes. Do you know if there are any documented manifestations, and what are the pathogenesis of this?
Well, I think the question is even more expansive to be, does there appear to be a pathophysiology related to the skin and related to the way that this virus behaves? Is there a connection there? I mean, logically speaking, what we're all learning, and again, there's no proof of this, is that there is some effect on vessels. There is a hypoxic effect, like in the lungs, there's this hypoxic effect that these patients crash. There appears to be a similar phenomenon occurring in the skin, but it hasn't been elucidated yet. Now, what we're seeing, we're starting to see pictures of patients that have these kind of vascular presentations, petechiae, livedo-like patterns, the so-called COVID toes or COVID digits, where we see these dusky hues on the tops of knuckles or on the digits. What we call acral ischemia. There is some blockade, there is some loss of oxygen to the vasculature, which also appears to be affecting the skin. And it's why we really need more of our colleagues in dermatology when we see these cases to do biopsies. And I mentioned I had a young man yesterday, and to me, in addition to his hives, he looked like he may have had COVID toes. I did some biopsies yesterday. I mean, I want to try and provide my colleagues, myself, of course, my patients first and foremost, the most detailed information we can find, because moving forward, maybe what some of these signs are true dermatologic manifestations of a systemic illness, like a viral illness, like this novel COVID-19 virus.
It's fascinating, and I'm glad you bring up COVID toes. Obviously, that's something that really captivated our audience, I think, the other night in terms of wanting to get feedback and expertise on exactly what the manifestation is and what they've seen with it. And that's actually pertinent to the last question we had here from an audience member. Do you think frostbite patches seen between patient toes may be of diagnostic value for COVID-19?
I think it depends on the presentation of the patient. They certainly could be. Once again, this is a learning experience for all of us day to day. This so-called perniosis that we're describing may be a hallmark of COVID-19 infection in some patients, and it may be a presenting sign. And I think we've seen this in some patients, as I alluded to before. So I think that stay tuned. There's more to learn, but there's some hypoxia, there's some injurious phenomenon occurring in the vasculature as it relates to some of these skin manifestations that we're seeing.
Well, that's great to hear. And thank you so much for fielding those questions. Again,
Of course, thank
I
you.
know a lot of people are curious for that, and we're going to have a lot more follow-up on hcplive.com in the few days following this webinar, just adding more insight into all the discussion points. Dr. Glick, do you have anything else that you'd want to add in terms of following up on the webinar discussion points? I know we went into more than just signs and symptoms.
Well, first of all, I want to say in general, I thought that the webinar went great. We had a really nice attendance, several hundred attendees. I'm always thinking of patients, so I almost said patients. I think it was a great opportunity for our three presenters, Dr. Gelfand, Dr. Council, and Dr. Friedman, to present some very impactful information about what's happening in our space of dermatology right now, and what the impact has been from the virus. And I hope we do some more of this. And I look forward to working with you again in the near future, Kevin, with you and with HCP Live.